what has been a little bit distressing over the last week is people are picking and choosing data that is typically accurate data to accomplish the goals that they want to accomplish.
Welcome to the RANE Insights on COVID-19 podcast. I'm Emily Donahue. Let's listen as RANE founder David Lawrence speaks with Drs. Fred Southwick and Bill Lang for our weekly coronavirus update.
Fred and Bill, as always, thank you in advance. This has been an interesting week with new data coming out about the Delta virus and questions about the efficacy of the respective vaccines. What can you share with us? Obviously, clients are trying to manage this issue. People are very worried about personal safety and security, the reopening of businesses, schools, and what rules should be followed.
David, to me, what has been a little bit distressing over the last week is people are picking and choosing data that is typically accurate data, but it depends on how you put it together and how you portray it. People are using it to accomplish the goals that they want to accomplish. I think so. Trying to get to the deep actual data and what does the deep actual data say is real important. And what I'm seeing is that everything is very consistent, that if you are immunized, you are very effectively protected against serious disease and death, including with the Delta variant. That's, to me, the most important piece of data. Now, people who are vaccinated are still getting COVID, especially with the Delta variant, but they're not getting sick. And that's happening fairly regularly. But with the way that we're reporting data, that we're just reporting the rates of all people getting it, is complicated because we're talking about two totally different populations and two totally different outcomes. If you were vaccinated, you have one set of risks and one set of outcomes. You're not going to get that sick by and large. The overall risks and everything is about risk. If you are not vaccinated, then you have a much higher chance of becoming infected and a much higher chance of getting significant disease and dying. But we're not reporting it that way. We're reporting it as a global number, and that's just getting to be very problematic.
I agree with Bill. In fact, I was advising a company that has a factory in West Virginia. I asked them what the prevalence of disease was in West Virginia, and they said it was 5 per day, 5 new cases per 100,000. That's a low moderate level of activity. However, when we dug a little deeper, only 50% of West Virginians are vaccinated. Therefore, really, for those that are unvaccinated, which almost all the cases that are being reported are among unvaccinated, it would be more like 10 per 100,000. And that is now high moderate, and you really need to adjust your activities in your factory when the levels are higher. So I think whatever the percent vaccination is, then that should determine, you should if half the individuals are unvaccinated, then multiply the value that's being reported by 2. And then you'll have a more accurate assessment of the activity in your area and what you need to do.
Well, and here I can give a specific the numbers on that from an actual case. And in Israel, and we were talking about how some of the Israeli data is not perfect, but still Israel was saying that they have a 50-50 ratio in terms of infections. 50% are in people who are vaccinated and 50% are in people who are not vaccinated. But there's only about 20% of the population in Israel that's not vaccinated. So if you take that ratio and you apply it against the real numbers, then they have a rate of about 15 per 100,000 per day in those who are unvaccinated, which is widespread community transmission, and a rate of right around 2 cases per 100,000 per day in the vaccinated population. And that is that's sporadic transmission to the point where you need to be aware, but you don't need to do a whole lot to protect against spread. But those are two very different populations, and the management of them are very different.
The other concern, Bill, as we talked about before, is what's your definition of infection? It turns out in Israel, they are rapidly case finding, and anybody that was a contact, they're performing RT-PCR. They define an infection as anyone with a positive RT-PCR, no matter whether it's a low level of virus in their nose or a high level. And so they're overestimating the degree of infection among those that are vaccinated. Other parts of the country are really only testing vaccinated individuals who are symptomatic. And that's why the attack rates among vaccinated in the U.S. is far, far lower.
Bill, it seems to suggest that as people pick and choose the data, they seem to be doing it for various reasons, some of which, could be to drive clicks and eyeballs and such. Some may be for political reasons. Based upon, the various commentary, some new data that's emerging, what are you and Fred advising your clients to do with respect to reopening, with respect to social distancing, et cetera? Is there any change of course?
I'm generally not advising a change in course right now. I'm also, while the dust is still settling with the Delta variant, I'm not saying to move rapidly ahead with reopening, but also don't use Delta as an excuse to go back to keeping offices closed, not bringing people in. The biggest question that I'm finding with a lot of firms is almost a cultural question. Do they or do they not want to ask if their staff has been vaccinated? That's kind of the first big divide. While we're talking about an authorized vaccine and not an approved vaccine, that makes them a little bit uncomfortable with making personnel management decisions based on whether someone is vaccinated or not. But what is clear to me is that companies should be very comfortable bringing people back into the office for vaccinated people. Unvaccinated people, or especially if you have a large number of unvaccinated people in your workforce, which means you have to have asked the question to know, that does get problematic because you can very rapidly spread virus amongst unvaccinated people in a workforce. But if you're all vaccinated, then or the large number, or at least the people that you're having back in the office are vaccinated, then that's fine. In my opinion. Fred, I'd be interested in what your thoughts are on that.
Bill, I agree completely with you. Those that are vaccinated are safe. They will not get serious disease, and they will not spread the infection. The problem is those that aren't vaccinated when it comes to the Delta agent. There was an ABC report of a case in Australia where there was a camera that actually showed two people walking by each other. One was infected, the other was uninfected, and they faced each other and just passed by. And the individual who was uninfected became infected, and they actually did sequencing of that virus. It was identical to the other individual who was infected. So just casually walking by somebody can spread the Delta agent. This is much worse than the wild type. And therefore, in a work environment, if you're unvaccinated, you could be spreading it to other individuals that are not vaccinated very, very easily. And it raises concerns whether masks are even sufficient. I worry whether anybody who is not vaccinated should be coming into the workspace.
And so the points you both are making here is that the people who are most at risk to the Delta variant are not those who have been vaccinated, but to the contrary, the people who have not been vaccinated.
Exactly.
There was some data that came out of Israel, and I think both of you have alluded to it, just that seemed to raise some questions about relative efficacy between one vaccine versus the other. Any insights that are worth sharing?
As far as the protection from, this is the issue that we just talked about a little bit, sir, but to clarify, the Great Britain, UK, has studied the Delta agent and the efficacy of Moderna and Pfizer, actually specifically Pfizer. They found that if you had two injections, that the efficacy dropped minimally from 94 to 88% as far as symptomatic disease, mild to moderate symptomatic disease. So still excellent efficacy. Israel claims it's about 63%, so much lower. But as I mentioned, they are actually doing RT-PCR on people who are contacts that don't have any symptoms. So they are actually underestimating, in my view, the efficacy of the Pfizer vaccine to the Delta agent. I think it's better than 63%. I would put it at about 85 to 88%.
Which is consistent with what other investigators around the world have found.
Again, helpful because the news certainly ran this week with the purported report out of Israel about the efficacy of the Pfizer vaccine being potentially less than Moderna and raising questions about the degree of efficacy.
But remember, one thing I've got to make a point on with that is that was the way that the media portrayed that. When you read what the scientists who were putting that out said, they said the good news is that it is still very efficacious. They were looking at 65-ish% efficacy. That's not bad for a vaccine against a virus. So that's kind of worst casing it is still not bad. And that is only looking at efficacy against prevention of symptomatic disease. The efficacy against prevention of severe disease and death still is near 100.
And Bill, thank you for, again, underscoring that for our audience, because too often it's the headline that is driving decision-making. And as you said, it's the way the media is reporting as opposed to how the scientists are sharing data these days. Just in terms of, there have been some reports, and I say this because we have a number of people who either are in Asia, traveling to Asia. There have been some questions about the efficacy of the Chinese vaccine. Do you have any perspectives or thoughts that you can share with the audience?
Everything that I've seen is that the Sinovac vaccine, there's the Sinovac and the Sinopharm are the two major Asian vaccines. Most of the data that we see are about Sinovac. And remember, there is very little formal data that is coming out because the Chinese are not reporting. So much of the data that we're getting is from some of the smaller countries that are reporting their own data. So the data that we're seeing is not incredibly reliable in any event on either of the vaccines. But even with that, with the Sinovac vaccine, reporting efficacies in the 60s, so comparable to what we are seeing with with Pfizer, but there's not a high degree of confidence with that in it by any means.
Yeah, I found it disappointing that the Chinese have not published on their vaccines in peer-reviewed journals, as far as I know. So it makes it very difficult for to assess the efficacy of their vaccine.
And I assume the same is also the case with respect to Russia's vaccine that I know is being used in parts of South America, Latin America, et cetera.
Well, with the Russian vaccine, certain countries have just decided to stop using it because regardless of what has been reported, they were not having good results with it. Now, but I would say, and I had this question asked me this morning, a group I was from an Asian group that I was doing a Q&A with, if they only have access to the Sinovac vaccine, should they pass and wait until sometime down the road when they have access to another? And I said, no, there is decent reported data out there from third-party countries that there is a fair amount of efficacy. It's just we can't really put a finger on exactly what that is. So it's better than nothing. But I think that has to be kept in mind. I don't want to throw out the baby with the bathwater.
All right. The other area of questions that have come up are dealing with the demographics and the age groups who should be taking the vaccine. And is there anything new just in terms of thinking about some of the younger generations, the 12 to 18, below 12? Any update in terms of what the guidance you can give to parents?
One of the big news items this morning, and I think I haven't been following the TV news, but I think there's probably a lot out there, is a 13-year-old child who died of what appears to be, we're going to have to wait and see what the pathology comes out, myocarditis 3 days after getting the vaccine. And I don't recall which of the mRNA vaccines he received, but died 3 days after, and appears that it was myocarditis. And so now the drumbeat is that, see, this myocarditis is a big problem. It's not self-limited. We really need to rethink about giving it to kids. Well, the fact is that type of reaction, on a very, very low level, can happen with so many kinds of vaccines. That type of reaction is a known complication of vaccines, because you suddenly spur the immune system, and sometimes the immune system runs away a bit. But you have to look at both sides of the risk. A case does not change the overall risk to any great extent. And you have to consider what are the real numeric risks in getting the vaccine, and compare that against the now very well-established numeric risks of getting the disease, and then the complications that can go along with getting the disease. And when you go through and crank those numbers, the vaccine, including for the kids over 12, because we don't have the data on the younger kids yet, the data is still very much in favor of get vaccinated. And unfortunately, yes, there will be these very sad cases, but you can't make decisions that way. You've got to look at what are the risk factors on both sides.
I completely agree with Bill on this. And one of the big concerns is that the kids are going to be going back to school in the early fall. And we've already seen there was an outbreak, I think it was a camp in Illinois, where they had 130 cases of infection from the Delta agent in a camp where a large number were not vaccinated. So the danger is we're going to have an uptick as school starts, and this will cause all kinds of concerns to parents, will further interfere with the education of our young. And so I think it's very, very important that they be vaccinated, so they will be safe at school. And clearly, the benefits far outweigh the risks.
Fred and Bill, first of all, thank you for those insights. Quick report from the streets of New York, July 4th weekend. A lot of people very, very tightly connected for fireworks in the parks. Vast majority of people not wearing masks, et cetera. Are you expecting an uptick in some of the infection data in the next couple of weeks? What should we be looking for, and what are the insights that you think will be important?
With the data that we've seen, I think I probably talked about it last week out of Australia about how minimal that contact can be to result in infection with the Delta variant. I think it would be surprising if we do not see an uptick in the number of cases. But again, I go back to, if these are upticking cases in people who are vaccinated and it is not causing severe disease, then that's not something to terrify us. And then the people who, if it's an uptick in cases and people who have not been vaccinated, then it's just one more piece of evidence that you need to go get vaccinated.
Yeah, but the good news is, Bill, in the New York City area, the number of new cases per 100,000 is about 1. So the number of individuals that are likely to be infected in that crowd is relatively low. But as you say, the Delta agent at just minimal contact could lead to spread. And there could be one individual that could become a super spreader very, very quickly.
And Fred, I would just add to that, if you saw some of the crowds that had assembled over the 4th of July weekend here in New York, some of these for sporting events, some for fireworks, some just naturally in the parks, I couldn't help but think about both of you guys and some of the data that may yet, reveal, we'll call it the implications of the Delta virus and how many people are being vaccinated. I think the U.S. just hit, the 50% mark? I think, notwithstanding the president's goal of 70%. So I assume we'll have a fair amount to talk about next week.
Well, and just to be clear, so what the president said is he wanted to see 70% of the country to get at least one shot.
One vaccine, correct.
Right, and we reached, I believe it was 67%, and where we stand right now is we're right at 69% of the population has had at least one shot. 47.6% has completed vaccination.
Right.
And that's the whole population, including children. So that number, you can actually multiply that for adults, add a factor of 1.3 or so onto it.
Okay.
1.2 maybe.
So, Bill, not trying to be the lawyer with the last word in court, but we started the conversation with you saying people picking and choosing the data. And the president, when he first announced the initiative at 70%, did not make the distinction between getting one shot and two, but as the pace kind of revealed itself, it became at least one shot. Either way, it's an accomplishment. Either way, there's obviously more work to be done. And at 50%, the point that I think you and Fred are eloquently making is the Delta variant is a game changer. It is possibility of it being spread very, very quickly is important. And so the takeaway is people who have not been vaccinated should really do so forthwith.
Agree completely.
Okay.
I agree.
All right, guys, thank you so
Thank
much
you.
for
Thank you,
paying
David.
such careful and thoughtful attention to the data. So it's truly a great benefit to have you on. Thank you, guys.
Thank you.
Thanks, David.
Dr. Bill Lang is an expert in public health responses to biological incidents, including pandemics. Dr. Fred Southwick is an infectious disease specialist at the University of Florida College of Medicine. Both doctors are part of the RANE Expert Network. Individuals and organizations turn to RANE for risk intelligence that cuts through the hype to focus on what they need to know, what to expect, and what to do. Sign up for our coronavirus solution and get critical information on the COVID-19 pandemic delivered daily. Visit us at ranenetwork.com. That's RANE network.com. I'm Emily Donahue. Thanks for listening.